Hi, my name is Darren Chandler from Go-To Imaging, and I just wanted to share a quick case history on how to identify a certain lesion that we see commonly day to day when reviewing MRI scans. The reason I thought I'd talk about it briefly is that when I first saw it, it is a little bit daunting because it's so obvious on the vertebral body. Now you'll see here, we've got two sagittal slices. The one on the left is a T2 weighted, the one on the right is a T1 weighted. And you'll clearly see that in the vertebral body of L4, just here, and the vertebral body of T9, you'll see these bright signals, a spherical sort of lesion in both vertebrae. And if you look at the T1 vertebra, you can clearly see that it's also present, but the signal isn't as bright. Now, if you understand the two, in which T2 shows water and fat as being bright signal, and the T1 also shows fat being bright, but it actually suppresses the water content. So you'll see from the CSF in the spinal cord, it's of a dark color. So we know this is purely highlighting fat on the right of the screen. Now, because these lesions are present within the vertebra on that T1, you know there has to be a certain makeup of fatty tissue within them. And they're slightly brighter on T2, and that's because they have blood vessels within, so hence the water is also coming up as a bright signal. So this lesion is part water and it's part fatty. And the name of the lesion is a hemangioma. So hemangioma. And how do we know it's a hemangioma? Well, if you was to tap on and we just increase the screen and we look inside, and if we do the same on the T1, you'll clearly see that it has this particular sign and it's lots of little black dots dotted around. Because it's spherical and it has lots of black dots and it can be seen on T2 and T1, then we know it's called the hemangioma, and this sign that you're looking at is the polka dot sign due to all the little black dots, and that would be indicating that there's a combination of fat and blood vessel entwined within the trabeculae. So we're just looking really at the sort of dotted outline in which it gives us. So nothing to worry about, completely normal. You see it on at least, say 4 to 5 out of 10 scans that you look at, you'll generally see hemangioma. The only problem is that there are different types of hemangiomas. These ones we're looking at here are typical, and you can get atypical and you can get aggressive. So if you want to know more about how an atypical and an aggressive manifests and potentially gives a patient pain, then we'll be talking about this further on the webinars and seminars that we've got coming up on the website. So look out for further details on that. Thank you.